policies. Now, I talk to a lot of people and they say, oh yeah, I know about Safe Sport. I did the Safe Sport training. I'm Safe Sport certified. I did the video training. And that's all well and good, but that's only one component of the Safe Sport or the Authorization Act requirements. The most important parts are that all of the non-Olympic youth sports or youth activities organizations also have to have a policy in place that's communicated to the parents and the athletes that defines what abuses are prohibited and what to do if you feel you are a victim of those abuses. So early on, I started doing for USA Hockey Safe Sport investigations because Minnesota put it in practice ahead of everybody else. As the other sports came online, the other Olympic sports, I started doing Safe Sport investigations for them and have actually been doing so. I represent, I think, 13 Olympic sports now, and then a whole myriad of other non-Olympic but nationally based sports, helping them with a number of things. One is doing their Safe Sport investigations when they receive reports of abuse that are not accepted by the Center for Safe Sport. They only deal with sexually related issues. Anything else like bullying or hazing or harassment, that all is left up to the devices of the individual sport to complete those investigations. I also consult with sports that want to put in a Safe Sport type policy, and in fact, you can't even call it Safe Sport anymore because the Center for Safe Sport has trademarked that name. But a Safe Sport like policy, if you want to put one in place, I help various sports consulting wise doing that. Or, and third, if a sport wants to conduct their own investigation, in a lot of cases, I'll either review the results of their investigation before they take action or assist along the way on to a lesser degree. The investigation piece is important because a lot of the sports are finding that when they do the investigation themselves, then there's always allegations from one party or the other that there's bias, or the good old boys network kicked in and things are being covered up and you didn't do a good enough job, all that kind of stuff, and that just muddies the water even more. I have a successful business. I do this not for free, but I do it with the understanding that nobody has any money, especially now. Even USA Hockey is having financial trouble. So I charge very modest fees for the work I do. I enjoy it. I'm semi-retired. So this is sort of a side project that I work on. And as far as I know, I'm the only person in the United States that specializes in Safe Sport investigations. Now, some of the things Dawson and I were talking about over the last few weeks is the goal of all of this is to keep attorneys out of the mix. In most cases, if you have policies in place that define what's supposed to happen when something kind of goes off the rails, and if you follow those policies when inevitably something will go off the rails, as long as you have the policies and you follow the policies, you're going to be not immune ever because anybody can sue anybody. But if you have the policy, you followed it and adequately applied what's within it, you're kind of going a long way to create a safe spot where you're not likely to have to tangle with attorneys. And the expense of that is the problem. So obviously, Safe Sport was created in an effort to minimize, reduce, eliminate, hopefully, the various abuses in youth sports. But at the same time, it's also a giant CYA in that we can then say, we have policies, here they are, we followed them, we told the parents, we trained everybody, we screened the coaches, we've done everything we needed to do, and then you're in the best position you can be in. Anything else you want me to touch on, Dawson? You're muted, I think.
It would be a good idea, if you didn't mind, that afterwards we could send something out just as a resource to them, just making sure that, hey, do you have this taken care of as an organization? Are you planning to do this training for your coaches? Here's some resources to do that, those kind of things.
Yeah, I mean, I'm aware that you're limited on time tonight. I could talk about this for hours, but if anybody wants to reach out to Dawson, he can give you my contact information, and I can give you way more information in detail. This isn't going to go away. The pressure keeps getting ratcheted up. The Safe Sport Authorization Act, I believe, was something of a knee-jerk reaction by Congress to the Dr. Larry Nassar problems with Michigan State and USA Gymnastics. But be that as it may, they passed the law, it's real, and everyone's keeping an eye on it, and it is only going to ratchet up. So the best idea is to be never caught in a situation where you had a problem and you just didn't take the steps necessary either to address the problem or have the policies in place in the first place. So Dawson, has my contact information. If anyone wants to talk to me just privately, happy to spend the time with you. Whether you want to email me, text me, call me, whatever, he can give you all that.
So I appreciate that, Scott. I think what we will do again is we'll send something out to everybody, just kind of some questions on making sure that you have these things in place. I mean, I think it's very important. Yeah, Trusted Coaches has child safety training. There are other places you can get it to make sure that you are in compliance with this federal law. And then you as the organization, just making sure that you have your policies and procedures in order. So if there is something that comes up within your organization. I know one thing that Scott and I talked about was, as those organizations that have joined or are going to join the Minnesota Youth Basketball Alliance, I know that Scott has offered up as his consulting services, if there is something that comes up, that he would provide you guys the ability to use him and try to provide you that most reasonable rate as possible. MYAS used him not very long ago just to make sure that we were following through on the right things with a situation, and he is fabulous to work with. So all it is to everybody is it's a resource, and just an FYI as a reminder that besides concussion instruction that came into play in 2011, that your coaches every 3 years must be certified, you also have your insurance requirement of a nationwide criminal background check, and the best practice is the annual check. And this is the other big one that is in play, is the Child Safety Training or Safe Sport Act. So Scott, thank you for joining us.
You bet.
Get information out. I appreciate it.
You mind if I hang on and watch?
That you can give some pointers. Yep. All right.
Thank you. Thank you, everybody.
Yep. We're going to move on really quick. So this is a hot topic. Myself and Jeremy have both had the opportunity to get to know Jamie Murphy over the course of the last, since May. I was a part of some initial meetings, a working task force on return to play for the statewide youth sports organizations, the National Sports Center, Minnesota Amateur Sports Commission. They put all these groups together, and it was the same kind of setting where we had all these people connected to a Zoom meeting or a Google Meet. We worked with Commissioner Tarek Tomes, and Jamie has been kind of the main liaison between this working group of statewide organization leaders of all the sports, along with all the facility owners, and then working with the Minnesota Department of Health and the main state epidemiologists of Jane, and correct me if I'm forgetting, Cynthia Kenyon and Jane Griffith. And yep. Jamie has been a fabulous resource, and we have been blessed to be able to have him on my bat phone, as I've been calling it, because I've been calling him, texting him, and he is so willing to share what he knows and making sure that if he doesn't have the information, he can get that information to us. He's got background. He was, don't hold it against him, but he was an Iowa Hawkeye, played collegiate football there from 06 to 09. And he actually got his master's in public health, right, Jamie?
Yep.
So,
I got my master's in public health in Minnesota. So there's
trying to even it out. So anyway, Jamie, the floor is yours. I have your PowerPoint queued up, so I can get that going while you start talking, kind of share a little bit more about yourself.
For sure. Yeah, and thanks for having me, Dawson. I really appreciate that intro. It's really flattering. But I mean, I'm just here happy to help. You know, we saw an opportunity at the Minnesota Amateur Sports Commission. You know, not having some sport representation when working with the current administration and the Department of Health. So we saw an opportunity where I could jump in there, utilize my master's in public health. I studied community health and epidemiology. Again, also a 3-year letterman in Big Ten football. So wanted to be a good in-between. I often sit between the Department of Health, the Commissioner's homes and the Waltz administration, and a lot of these youth sports orgs. I also work with the Minnesota State High School League. And a lot of these, you know, a lot of the conversations, as we're going to see here today, I mean, you have to have your preparedness plan, stick to it, you know, only allow things that you can enforce, you know, when it comes to spectators and whatnot. But today, I'll focus on, I guess, the most hot topic or the conversation I seem to have most frequently, which is what is the protocol to have when an athlete has COVID? And also, what's the protocol when an athlete is exposed to a lab-confirmed COVID case? Just give a little background. You know, if you are, you know, someone has a confirmed case and you are in close contact with them, you're gonna have to self-isolate. The Department of Health does the best they can. You know, once someone tests positive, that lab result gets pulled into their queue. Their contact tracer reach out to that person within 24, 48 hours. And then they have a conversation about who they were in close contact to that 48 hours preceding either their positive test or when they became symptomatic. And they're trying to identify all these individuals who are exposed. They'd ask those people to self-isolate and hopefully kind of mitigate the spread of the virus. Now, sports isn't as, I guess, clear-cut as, you know, let's say a normal social setting. All it takes is some kind of face-to-face impact. You know, you can expel some air droplets into someone else's mouth, and, you know, it just takes, I guess, an unfortunate chain of events, and you could get COVID that way. Where in a normal setting, you probably have to be in a room, close contact with someone for a certain amount of time. So we'll jump into the exposure first. The easiest, you know, dealing with when you have a case, that's pretty straightforward, but this is a little more amalgamous. So I want to try to walk through it, you know, really, really easily. We'll start off with the scenario. Your athlete discovers they are exposed to a lab confirmed case. So, you know, that person they are exposed to has to have tested positive. This key window is 48 hours before that positive case became symptomatic. This 48 hours is kind of a key number, whether it's a positive test or becoming symptomatic. You always want to look at those 2 days or 48 hours preceding. Anybody that was close to them, and close contact is defined, you'll see here at the bottom, is typically defined as 15 cumulative minutes of contact of less than 6 feet. But there's another caveat, and the Department of Health asked me to put this here, you know, but in sports settings may be assessed differently. Basketball being one of those that probably will be looked at slightly differently, like football, like hockey, any of these kind of closer physical contact sports, the Department of Health is going to exercise a little more caution, and they may be self-isolating more people. There have been plenty of cases, unfortunately, that I've been a part of, or not a part of, I've been on the calls with in basketball. They happen in all sports. So, I mean, not to blame anybody, but it seems that the spread can happen in quicker than these 15 cumulative minutes. I would assume if you play basketball in a game against someone with the team, most likely you'll be looking to kind of self-isolate or put pause on that team for 2 full weeks. So under this, going back to this ideal scenario, So let's say the athlete finds out they are exposed. Let's say a friend called them, and he's like, you know, you stayed over at my house 2 nights ago. I ended up testing for COVID positive today. So that kid would need to self-isolate. Ideally, they call their coach, let them know that they were exposed. They do not go to a practice or game. So once they feel like they are exposed, they have to kind of self-isolate and stop doing team activities. Also, they should inform the coach of anyone else on the team who may have been exposed. So the Department of Health will do contact tracing, but they'll even be quick to admit the sport people, us, will know more about who was around who when than they will. So, you know, we can wait for the Department of Health to make this determination, but at the same time, I would really recommend that if you know someone was around someone for 15 minutes or less, or they're in really close contact, that person should probably be isolated. I'm putting in the chat right now, this is an email address. This goes directly to the Department of Health. It is a sport-specific one. Any questions you have, go there, or obviously you can go to myself and just type in my email there as well. So in case you have any questions, because again, I'm trying to, you know, spell this out as clearly as possible, but again, I understand that these aren't always clear cut. There's always little uniqueness to these. This PowerPoint will go out to everybody too. Yeah, so you can have these slides and know what this protocol will be. So that athlete and anybody who also meets this exposure criteria or who is in close contact, they must self-isolate for 14 days from last contact with the lab-confirmed case. So let's say there was a game on Sunday. It's now Tuesday. We just found out that a couple kids on our team, or our team, was exposed. We'll have to isolate for 14 days starting back from that Sunday. So 2 full 14-day, you know, 2 full weeks. That athlete and the team, they must stay in quarantine or self-isolation for 14 days. This is a misconception I've seen from a lot of people. A negative test anytime during that 14 days does not break you out. You don't get out of quarantine jail. The 14-day stay is a 14-day stay. So the way that the Department of Health and the state is operating right now, once exposed, you are self-isolated for 14 days. If that's your whole team, that applies to your whole team. No practicing during that time period. Everybody needs to kind of stay home, lay low, and you know, mitigate any potential further spread. Dawson, let's pop over the next slide. So assuming, or not assuming, unfortunately, sometimes these exposures turn into positive cases. So let's say the athlete in quarantine develops symptoms of COVID-19, or they get a positive test. So then that person needs to be isolated for 10 days from symptom onset. So 10 days from symptom onset for positive cases, 14 days from last contact for exposure. You know, that person, any siblings, anybody in their household, when there's an active case in that household, anybody who lives with them is considered exposed. So if you have, let's say, you know, the older brother has COVID and he has 2 younger sisters and they're in soccer, they can't go to soccer either. They have to stay for that 14-day exposure period. They could possibly develop it at any time. So kind of in the essence of time, moving over next slide to what happens in a positive case. Since we already kind of briefly talked about it there. So let's say you have an athlete who has COVID-19 symptoms or has a positive COVID-19 test, and let's say they're not in quarantine. Again, symptoms are anything on the bottom left of the page with fever, chills, cough, shortness of breath, fatigue, muscle body aches, headache, new loss of taste or smell, sore throat, congestion, or runny nose. Any of these symptoms is enough criteria for your athlete to stay home. I understand that there is some like allergy seasons, you know, like only when you really for sure know it. I've run through so many cases of individuals saying that, you know what, if it wasn't this COVID times, if I wasn't hyper aware, monitoring my symptoms, I would have completely thought I just had a light cold. So I urge caution, and when you're bringing, no, just one symptom even. I mean, it could be 2, it could be 3. But, you know, any of these symptoms are going to be something that would typically disqualify you from coming to a practice. And I know it does seem like it is a little aggressive, and it's intentionally aggressive. They're really trying to mitigate the spread. You're going to catch people with colds. You're going to catch people with allergies. You're going to catch people with like, you know, unrelated upper respiratory illnesses, especially as we get into that season in the fall. But this is all in the play of safety. So let's say this person has a symptom. They do not go to practice. They tell their coach what symptoms they have. Tell them when they started having them. So this coach kind of has an idea of what maybe that 48-hour time frame is. Just, you know, waiting until you get a test. That person should stay home, isolate in a room from others, you know, away from others if possible. So if symptoms persist or worsen for 24 hours, that's when that person should get tested, and they should self-isolate until those results are returned. So if negative, but these symptoms still seem to persist, that self-isolation for 10 days needs to continue. As we said, it's not straightforward on when you are going to get symptoms, when you can get sick. I mean, you could get around day 8, you could start feeling symptomatic. And so from everyone who thinks it's different, this is from the Minnesota Department of Health. We are not the Minnesota State High School League. They do have their own considerations, their own body. This is directly from MDH. I had this in front of 2 senior epidemiologists, Cynthia Kenyon and Jane Griffith, who gave the review, and a lot of this language is there. So I promise you this is accurate, and this is what we are doing at the youth level. The high school level can operate under different considerations. However, this is our best mode moving forward. I'm going to get to that question once I finish, because that's a good one. If symptoms persist or worsen for 24 hours, yeah, that person has to get the test, self-isolate until they get results. Now, if the doctor that you take the test says the symptoms are due to something else, if they can definitively say it's strep throat or allergies or something, that person can get out of isolation. If you have these symptoms on the left, but they can't explicitly tell you what it is, you need to continue your self-isolation. So persons with COVID-19 can leave isolation after 10 days, as long as they do not have a fever, and in the past 24 hours, their symptoms have been resolving. Now, there's a final recommendation. This is something relatively new. Athletes are strongly recommended to contact their healthcare provider before they return to sport. So under the assumption that, you know, everything turns out fine, they're returning to sport, just ask to have your athlete, you know, talk to their healthcare provider. Some will, you know, provide some kind of like low-level cardiac screening, some, you know, a quick EKG, just to make sure everything is fine, there's no weird side effects. And others may give you the approval, but that's something you want to really leave to the doctor. So something we kind of strongly recommend. So I'll get to some of these questions. If one child is exposed and is quarantining, but has no symptoms, nor a positive test, do their siblings who are not exposed to the positive test also have to self-isolate? No, they do not. That's a weird, you really kind of hit this one weird exception. These degrees of separation. In exposures, it's only 1 degree of separation. Only the people who are in close contact with the positive case need to self-isolate. Now, when there's a case in the house, everybody needs to self-isolate. Now, there's like other considerations you have to think through. If that exposed person is self-isolating, that individual should do their best job keeping separate from their siblings. They should also be monitoring their symptoms. If they become symptomatic at any time and they have to go get a test, then if that test comes back positive, everybody in the household has to self-isolate. So, you know, in the exposure situation, it's only going to be those who are, you know, physically exposed, not those living with them. But in a case situation, anybody living in the household with a positive case needs to self-isolate. is it up to the coaches to send them home if they see a symptom? You know, if they don't, you know, I guess explain a symptom or tell you, if you start noticing them, it'd probably be the safe move just to send them home. Honestly, it's not worth the risk. Ideally, in most cases, it's a cold, they can be fine. But the last thing you want is having someone symptomatic at your practice, because what that really does is it kind of puts your next couple weeks in jeopardy. You know, a positive case and you have a bunch of individuals in close contact, then you're automatic 14 days. So play it safe, send individuals home. You know, you can protect your whole team by being really diligent with individual athletes, and that's something we would recommend. So sorry to kind of fly through that. I do this a couple times a week, but there's some really good questions. Are there any other quick follow-up questions? Again, I know Dawson will send this out to everybody. I know that the State High School League has something slightly different. However, you know, you'd be safe following this protocol, and this is the protocol that we recommend at the youth level.
Yeah, Jamie, what we'll do is if anybody else has any other questions, we'll make sure to get it over to you. So if you don't know the answer, you can get them. I know that Matt Broughton from Cambridge Isanti, he also works in the schools, and I think that was a direct thing from the school, not necessarily the high school league. So that would be something that we need to, again, this is a fluid situation. We need to continue to monitor it, and that's why it's so great to have Jamie here, and he's for all of us as a big advocate to make sure that we're doing it the right way. And he's gained a great relationship with Jane and Cynthia. That's I think important to know as we move forward, that this stuff may change over the course of the next 30 days. So we just need to make sure that no matter what, that we are following through on it the same across the board within youth basketball and every sport, so to speak. One quick question, Jamie. I know you've dealt with this. So if somebody is exposed in winter soccer training, they feel that they maybe know that there's been an exposure. Is it okay for them to go play basketball?
No, it is not. That individual should self-isolate for 14 days. Don't go to any other sports. Don't go to band practice. Don't go to choir. Don't go to speech. They got to be staying in their home for 14 days.
Okay. One quick thing. Scott from Edina had a question about Hipaa requirements. Yeah,
and so it's with Hipaa, you just want to be careful about names. I wouldn't be broadcasting that Jamie Murphy has COVID and anybody exposed to him. You know, there is a personal touch here there. If you start getting dicey about utilizing names, I would leverage that health.sports.covid19 email that I sent out. Them being the Department of Health, they can use names and date of births and medical information. So, you know, that they use that for contact tracing. But if you're doing broad messaging, it's best to be vague. We had a case of COVID on our team. We are shut down for X amount of days. Or we had a case on our team. They were not at practice during the exposure period. We'll continue to monitor for symptoms amongst everybody else. Again, I brought up something with other groups. You can do absolutely everything right, and you can get a COVID case on your team. And I've seen groups do, I'm not going to say absolutely everything wrong, but the absolute minimum, and they get lucky and nothing happens. So just keep in mind that there is an element of luck here, but having your preparedness plan and sticking to it is how you shield yourself from liability, just like Safe Sport. Follow up to Scott's question, are we required to do the contact tracing with phone calls to families? You are not necessarily required. Now, for the sake of your team and our sport, if you know someone is exposed and you know that the Department of Health has not been in contact, it would be on you to shut down those individuals that need to be shut down. What will help with contact tracing, I know this is a little easier at your level, keeping your daily attendance records, just maintain those in case MDH has to ask for those at a later period. And now I get that, you know, this is scary, and it can be scary when you get your first case. Unless you're doing something really egregious, I would not worry about the liability of your team and your sport. But also, on the other side of that coin, that's not reason not to be diligent with not maintaining your plan and mitigating the spread.
So I guess the big thing, again, it goes back to encouraging everybody to make sure that you dot your I's, cross your T's with your preparedness plan, making sure that if you want to, you steal our safe play back to the hardwood guidelines and other things that we've already created for gameplay, your practice stuff, and making sure you have that out there and available so everybody knows going into it what the expectations are. That's, I think, first and foremost, so you are mitigating your risk as an organization. Because if you're derelict, that's one thing, but if you're making sure that you're following through on it, that's the key. So Jamie, what we'll do is we will continue. Beth from Orono, one more quick one, and then we'll move on.
I see that one. Yeah, I'll move on. But so MDH, the only times MDH shuts down a facility is if they're completely out of compliance. It won't be because of actual spread situation. The more we've learned about the virus, it seems that hard surface spread, like touching the virus on a door handle or whatnot, they are less concerned about that and more concerned about person-to-person spread. So if there is a case in a facility, they're not going to blame the facility. They're not going to say you probably got it touching a bleacher. They're going to say that you got it from another person. So teams and associations and leagues those are what actually would get shut down or asked to self-isolate. I haven't seen an example of a facility have to shut down, other than one hockey facility that I won't name. They were completely out of compliance. People took pictures of that non-compliance. That's something else just to keep in mind. There's a lot of tattletales out there. There's a lot of people who everybody has a phone in their pocket now. So they will take pictures if they're non-compliant. I can't speak to their motivation. They're often all over the board, mad they couldn't fit in a certain seat, mad for other reasons. But that's how some of these individuals get shut down by the Department of Health. Mostly photos and someone trying to tell on them. Not trying to scare you, but just know that's a reality we're all dealing with out there.
Yep. Okay, Jamie, thank you. Jesse, yes, we believe that it is the right thing to do to have a waiver. And actually, we've worked with a colleague of Jamie's, Steve Olson, and we have one that we'd be willing to share. It's the same thing that we are using for any of our participation moving forward, that it's our code of conduct, but we've added also in the waiver for COVID-19. So that's another thing that we'll make sure that we pass along. So Jamie, thank you so much for being here tonight. And we will get stuff sent out. I'll work with Jamie on, I have the PowerPoint I'll get sent out, but if there's anything else that we think of before we get stuff out tomorrow, he can let me know. So Jamie, thank you very much.
For sure. Hey, thank you all. It's a pleasure. And let me know if there's anything I can do to help moving forward.
Okay, thank you very much. Again, I think the key is, and I know a lot of you have already done this, we learned really quickly as we attempted to launch our summer basketball tournaments and putting out our safe play back to the hardwood guidelines, that no matter what, if you have your own guidelines and preparedness plan, whatever your school district is saying or the facilities you use for practice or tournaments, that's going to trump anything else. And you're going to need to make sure that you communicate with your community ed program, with the facility, the director of your facilities, whoever that may be, and get out in front of it now and start talking about it. Because we've seen also that a lot of the schools do have some very extravagant stuff in place already that they're wanting people to comply with. So if you have not done that, I would start the conversations now to make sure that they understand that you guys are willing to do what you need to do to create a safe and healthy environment for everybody that would be coming into the facility. So moving on, this kind of ties in as a segue to what I think I think there was something related in the chat about, or maybe Jamie talked about it, with making sure to keep the roster or do tracing of people that are participating during your practices and then all the people that are a part of the tournaments that you're going to hold. I have been working with Craig Perry for the last month now. Craig has been a dedicated associate director of the Minnesota State High School League for 15 years. He's still consulting with them, but he's moving into a new role with the U.S. Council for Athletes' Health. And Craig is a native of Andover, lives in Andover. Well, he's a native of Canada, but he lives in Andover, and he's a great guy. A big guy when it comes to eligibility, but he also just wants everybody. The education is knowledge is power, and I think that's the big thing that we're all trying to get based on our educational foundation as a 501c3 nonprofit. We want to try to get as much information out there. Obviously, the most timely thing right now is COVID education and this other thing that Craig will discuss. And I know he knows that he's only got about 4 or 5 minutes. So Craig, it's on you, bud.
All right, well, thanks. I'm glad to back clean up. I'll try to make it as quick as possible, but I can tell you that with the presentation from Scott and the information provided by Jamie, I'm glad to be speaking in the third slot, because what we have, and I'm really excited about this, Dawson and I have been working for the last 4 to 6 weeks on a new partnership for the MYAS. So the MYAS and the U.S. Council for Athletes' Health, which I have been working with for over a year, but just formally went with them after I retired from the league in the end of July. We're obsessed with one single mission, and that is making sure that participation is safe and that we inspire organizations and programs to have the healthiest, safest, and well-being environment that we can. So the partnership with Dawson right now, we hope to finalize it this week, have a press release, and also outline for you what it will involve. But this is a partnership that's based on our athletic health space e-learning education platform. And what we're really looking to do is to create a trusted health platform for the MYS and all of the organizations that participate under that umbrella, like you with your basketball organization. So we have 3 or 4 different areas. We're partnering on an education platform that will work in conjunction with what Dawson's already doing through Trusted Coach. We have a couple of really great items right now. We have the COVID education classes. It's about a 10-minute e-learning module. The athlete and the parent take it together, the youth athlete and the parent. We have one for coaches. We have one for event workers. We have one for officials. And we have just completed, and we've tested it at 2 of the MYS state baseball tournaments this month, the month of August. We've tested our new daily screening survey. So we have our game day ready screening survey ready as well. So some of the questions that I saw in the chat were around, how do we monitor this, and what do we do if we have a positive, and the HIPAA rules and all of those things. So really, these are the things that we are going to be doing as a partner with the MYAS. And so the third category really will be beneficial as well. So not only do we have the education platform, the daily screening survey, and I'll tell you how that works in a second, is that we're working with Dawson to create health, wellness, and safety policies, a POP manual of policies, operations, and procedures that would incorporate all of the health, safety, and wellness policies a youth sport organization should have. And so that would include Scott's presentation, talked earlier tonight about safe sport. That would be part of it. And our partnership through the MYS gets you access to our medical experts as well, and access to me. So if you are creating or implementing policy under health, wellness, and safety with your youth association, I live in Andover, I'll just say Andover Youth Basketball. If you have policies and procedures that are based on health, wellness, and safety, we at the U.S. Council for Athletes' Health will review that. We'll partner with you. If you're a partner with the MYS and say you've got everything you need, or this looks great, you're missing some information on safe sport. And then if you do have a positive outbreak right now, COVID tends to be what's on everybody's mind. But if you have a COVID outbreak, we're there to assist with you. And here's how we get into this. So the way this works is the youth athlete and their parent take the class, and then that gets them access to our game day ready screening survey. The apps will be available from Apple and from Google within a week or 2. And the way it works right now is that we base it on emails. So we get the emails. We did a baseball tournament with Dawson, 16 teams. We took the emails and we sent out the enrollment so that every youth athlete and their parent created their own individual portal. They took the COVID class, which gives them the foundation level that they need. and it's appropriate for youth athletes. The course for youth athletes has been created specifically for them. And again, the parent and the student complete it together. Then they have access to our Game Day Ready app, which is a daily screening. So the daily screening asks the COVID questions. You can use this for practice. You can use it before a game. You can use it before a tournament. And if they answer the questions correctly and they get green flag, that means they have none of the symptoms that day. And then you can also use this when you do have events and you actually can have people attending. We've created QR scanning so that people who are attending can scan the QR code at your event, take the Game Day Ready, show you that their green flag cleared, and they can enter the facility and watch. And so at the baseball tournament, they were allowing 30 spectators per team. They had the wristbands to get into the baseball site. And we had a record of the athletes taking the course and doing their daily screening. Now, the great thing about all of this is we do all the work for you. You end up with a dashboard. So again, I'll use Andover Youth Basketball. You'd have one person that oversees all of youth basketball as your health and safety and wellness person. You identify a parent or a coach with every one of your youth basketball teams. We keep all of the data. It's restricted. And what we do is we make available to you. So maybe it's a parent of what your 10-year-old basketball team. The parent looks at it and all 10 kids on the team and the 3 coaches that day have screened clear. They can attend practice. If they're not cleared, it gives them a red flag. And then that person can let your coaches know that one of the participants in that team has not been cleared for the day. But we do all the work for you. We make it available to you so that you can just log into your protected site. You can pull up your roster. If you're overseeing the entire association, you can have a master directory, but every team would have access, one person or a couple, to their daily screenings, and are they cleared to participate in the game days, events that you have on weekends and your tournaments. Also that is going to be part of this is consulting. So we have a team of medical experts from across the nation. We're based out of Columbus. We have some people here in the Twin Cities. We have them on the West Coast. But if you have anything that happens from a health, wellness, or safety perspective, because you are a member of the MYAS and under that umbrella, you partner with us, and we are there to assist you and guide you in whatever category that you need the assistance. So I tried to give you the 5 to 8 minute spiel as best as I could for Dawson, but I'm really hopeful by the end of the week, we will have the partnership completed. There'll be some information going out to all the youth organizations, and the products that we have will be available to you as a member of that Minnesota Basketball Youth Alliance. Dawson,
So,
anything?
yep. I think the only thing is that, you know, we worked hard to try to get it to a point that it was extremely affordable for the organizations. And so it's open to all Minnesota Youth Basketball Alliance member organizations at $3 for COVID education, along with that game day practice and event tournament assessment, and that's for the entire season. Is there anything else, Craig, that you want to add on to that?
Yeah, I can add on to that. That what the partnership does is it gets you access to our experts and our products at a significantly reduced rate. If you are just the Andover Basketball Association working with U.S. Council, the rate and the access and all of the things I've mentioned would be significantly more. So essentially, a basketball player, get a member of your basketball team or your coach or your officials for the $3 gets the course and gets the screening app, can be used every day during the entire basketball season. And so all that does then from our point of view is we manage everything for you. We let you know when everybody has signed up. We let you know what the daily screenings are. We push to you, to whomever you want as your designated person, your daily screening so you can know who has been cleared and who has not been cleared. And also the partnership with the MYAS gets you access to all the other things I mentioned. Access to the education platforms we're going to be building with Dawson and the trusted platform, access to our experts. That's not at any cost to you. That's all part of the partnership we're putting together with the MYAS.
Okay, and Craig, $3 per player, correct?
$3 per person, per player and coach for the entire season.
Okay. All right. We will get information about that partnership. We're going to do a press release this week, but we're really excited about that to really ramp up our education and training even more. And obviously that's an extremely hot topic of education related to COVID, along with making sure that people are following through on that assessment. And you then can help foster that compliance by showing or proving that these people have completed it. So we're excited about that. We're going to shift gears. Craig, thank you so much for being here tonight. And we'll be in touch to make sure we get information out to everybody on this call tonight.
Thanks again. I appreciate the time, Dawson, and thanks to everyone tonight on the call. Appreciate your time.
Okay, thank you. I'm going to put my colleague of 20 years on the spot and good friend, Eric Rathke. Eric, we have an announcement related to grade state championships that I'd like you to talk about.
For sure. Good evening, everybody. I'll be really quick here. For those of you that may not know what the grade state basketball tournament is, it's kind of the cherry on top that wraps everything up for the winter season. Typically, it's held the first 2 full weekends in March. Obviously, due to the circumstances this year, we are doing some changes based on COVID. And this year, we do have it posted on our website right now. More information will follow, but we're actually moving the girls up a full weekend. So the girls' grade state tournament this year is going to be February 27th through the 28th. And then what we're doing for the boys, because the numbers are so high on the boys' side, we're actually going to split them over 2 weekends. Grades 3 through 6 will be March 6th and 7th. And then grades 7th and 8th are going to be March 13th through the 14th. Moving forward, there's going to be more information to come along the way here. But with COVID and all the stuff going on here, that was a decision we came to as a staff last week. So we're just starting to reach out to our hosts and kind of get that ball rolling. But if you don't know, again, what grade state is, it's kind of cherry on top. It wraps everything up for the winter season. It's a great finale for the teams as they kind of wrap up that winter season. Thank you.
Thank you, Eric. And there were a couple girls tournaments, association tournaments on that last weekend. We worked with Fridley, and we are currently working with Rosemont to make sure that we don't have any issues with that on working with those organizations at the end of February. All right, I'm going to turn it over to Jeremy Innes, Associate Director. He's going to talk about the Minnesota Youth Basketball Alliance. I know a lot of people on the call have already joined the MYBA. I know there is some concern out there saying, why do they need that money per team? I don't get it. What's the point of it? We're already doing this now. Well, the problem is that we aren't doing it together. We're kind of doing it independently or separately. Everybody's saying they're using MYAS rules and regulations, but we really need to come together and create this network where we have the ability up front, no matter where you are from, that you are getting all your contacts in place, you're getting all your rosters uploaded, you're properly identifying your teams a certain way so they can be tracked throughout the season. Then that's put into this big tournament network that everybody can utilize the same platform, and that's our hope through Tourney Machine, which then Tourney Machine would then directly dump all that information into Trusted Rankings, and Trusted Rankings no longer needs to be updated by an individual coach, which last year there were 2,100 teams that independently reported their scores, so it wasn't necessarily complete. And our hope is, and we're strongly, I guess, hopeful or optimistic that we will maybe be able to do it this year. We can't do live seating meetings, and I know a lot of you are upset by that, but we are in the process of hopefully strictly going off of our Trusted Rankings and not doing seating meetings anymore. So your body of work of a team, regardless of the level you're playing at, that'll be the true indication on where you should fit within the number of teams in 6th grade. And based on if you played some A, B, all that body of work will be available. So Jeremy, if you want to talk about some of the other highlights, I know we're running out of time, so if you can make it as quick as possible.
Got it. Yep, I will make this quick. So I'm going to share my screen here for the MYBA. Currently, we've got, I believe it's 75 associations have committed. Thank you very much. We appreciate it. The one benefit I'll talk about pertaining to this time of season is right now it's a lot of teams are signing up for tournaments, and we're getting emails and phone calls. Is this team eligible? Is that team eligible? Our intent with this Minnesota Youth Basketball Alliance is that all those tournament directors will need to do is just check the list that we've got on our website. We'll build it out a little bit more, but right now we just got the associations listed here. We really appreciate those association tournament directors reaching out to us though to check on the eligibility of the different teams, because compliance and following the guidelines is really at the core of the MYBA. And really at the end of the day, you know, with those renegade teams, all-star teams, we can't prohibit them from forming. What we can do is make sure that they don't participate against community-based teams in the travel tournaments during the winter season. Das mentioned a lot of the benefits as far as, you know, what's going to happen as far as making sure teams, associations comply with the same set of guidelines, how it's going to work with team identification and the partnership that we've got with Tourney Machine for the tournament bracketing service at a $2 per team rate, which was, you know, way better than the rate that we were providing people for our service in previous years. But how it's going to flow, the teams registered through the MYBA portal on our site into Tourney Machine. Those tournament results are going to flow directly into the Trusted Rankings platform. And then yes, we would all love it if we could find a way to avoid those seating meetings. If you look at screen here, we've got the register here button posted. It'll just give a few points here. The initial registration fee to be a part of the MYBA is $120. Essentially, since it's a requirement to have a minimum of 4 teams to be considered a legit association, at the $30 per team, that's where that $120 fee is coming from. And then I believe it's November 5th, you know, after everybody's had their tryouts and formed their teams, that's when you can submit the $30 per team for your additional team. So at this point, it's just that $120. We've heard from some of the teams that have, or associations that haven't registered yet, saying we don't know exactly how many teams we're going to have this year, so we didn't feel comfortable registering yet. So just a reminder, all you got to do is pay that upfront $120 fee. We've got a ton of information posted on the website here at this time of the, you know, relevant for this time of the season. Definitely check out the team composition guidelines that we've got posted. Make sure that the players that are registering for your tryouts and signing up for your association are eligible to play with your association. Age, grade, cutoff dates here. The tournament index. The only association members can post their tournament information on our website. We've got a very large number of tournaments already posted. If you don't have yours posted up there yet, I would highly recommend getting it on there. That page on our website gets a ton of traffic. Another thing I'll mention is kind of separate from the MYBA portal, or actually before I get to the team identification. This is a very important component to the MYBA Tourney Machine Trusted Rankings process here. Team identification, we've got it posted. We want you to follow this format. The team name, which in this example that I used here is Fridley. We want Fridley in that spot. We don't want FYBA or FBB, anything like that. We want the name of the community. And then we've got the gender initial, grade, and color. So Fridley, it's a boys team, 7th grade, and this is their gold team. We're no longer concerned about if it's their A, B, or C team, because as we found out a couple years ago, it's the percentage of teams playing in multiple divisions is a lot higher than we thought it was. And in this year, one of the big changes that we've made with Trusted Rankings is that teams can have data in multiple divisions. So if you're maybe a weaker A team that plays some A tournaments and some B tournaments, you can have a record and a ranking in the A division and also the B division. So we don't really care about the, like I said, putting the A, B, C, or 1, 2, 3, 4. I know some communities like Osseo, Maple Grove, I think even Prairie might do it. They use numbers. So in this case, instead of a gold, they might do a 1 or a 2 to identify their teams there. One thing I'll just hit on as we move into the season, you know, players are getting registered, people are signing up for tournaments. Make sure you have your refund policies put together and posted. I'd recommend 2 different policies. One for the participants signing, the players signing up to participate in your association. You know, if you advertise, we're going to play in 10 tournaments for this amount of money. What happens if 4 of them get canceled and they're only allowed to play in 6? Have a refund policy set. Have something that outlines what the non-refundable costs are. Also for your tournament, if you're hosting a tournament, have a refund policy set there. If you're going to refund 100%, that's great. If you're not, if you've got to, you know, for money for awards, it's non-refundable or things like that, make sure you get that posted, just so people know what they're getting themselves into to avoid any headaches down the road. We realize this winter there's just so much uncertainty with everything that it, you know, at this point, I know everybody's just moving forward with their tournaments the way they are, which is great. And then we're going to be doing the same with our winter shootouts as well. But we've also talked with a lot of different community association leaders about the possibility of forming a league to supplement those games that, you know, if you get a couple tournaments canceled and where are you going to find those additional games? Because really there's 3 different ways this winter season is going to work out. Everybody's going to run their tournament and everything's going to be fine. That's very unlikely. The other is that some tournaments are going to run and some tournaments are going to get canceled. So they're, you know, teams aren't going to get all their games. The other way we go is that, you know, all the tournaments get canceled and then maybe just with the uncertainty, maybe a league structure might be better. That way we could work with the communities that do have access to their facilities, find enough facilities to hold all the teams that want to participate in the league. And also another option would be with our winter shootouts, that we are really going to ramp up the amount of hosts that we've got, which isn't easy, but we're going to try to track down as many hosts as we can, just so that we are there to provide those teams an opportunity to play if the tournament that they're signed up for does get canceled. So depending on how things go, you might hear more information from us about the possibility of a league, or if that's something that you're really interested in, you like the sound of it, shoot myself an email or give me a call, Jeremy at MYAS, or reach out to Dawson, and we can discuss that with you.
Jeremy, just talk about our refund policy that we put in play for MYBA, so people understand that we're not just going to keep the money if the season doesn't happen.
You got it. Our refund policy for the MYBA, that $120 fee, that's the only part that's non-refundable. The other part, you know, we're going to know a lot more by November 15th on whether we're going to have a season or what it's going to look like, if we need to reduce that $30 per team or what it's going to morph into. But at this point, I would encourage everybody to wait until we get closer to that November 15th before you start paying that $30 for your additional 4 teams. And that $120 initial registration fee, you know, that's kind of replacing some other fees that we had in place in previous years too. You know, with the $75 fee to post your tournament on our website, now you no longer need to pay per tournament to get that up on our website. You just got to register to be a member.
Okay, I think Chance from Minneapolis Lakers had a question. I guess this is up to each organization what they want to decide to do, but we feel that we're at a place as a youth basketball community that we need to all come together. So regardless if you host a tournament or not, we understand that every organization on this call tonight are already complying with the criteria that's been in place and the rules and regulations that we put in place over the last 30 years. And you guys are all doing a hell of a job with it. So it's a way for us to all come together and say, hey, we are a community-based parent volunteer basketball association, that we're doing it the right way. We're proud to be part of the MYBA. Every organization out there in the state of Minnesota is part of the MYBA. And we hope that because of that, your teams would then be able to be participating within the network. Everybody's identified properly. They're then getting pushed into the rankings, which then ultimately hopefully makes that end of the year experience way better and way easier than it ever was previously. And I think in a nutshell, Chance, that's the answer to that one. But ultimately it's up to all of you. I mean, if you don't feel that it's necessary, that's your choice, but we want our community to be stronger together. We have never pushed membership. We don't want this to seem like it's a membership. Like Jeremy said, this is replacing fees that have already been in place with our scheduling services that we did with associations, with the tournament index listing. It basically is replacing that revenue. That's all it's doing. And it's then allowing us to be a more uniform youth basketball community because of it. So if there are more questions with that, please, again, like Jeremy said, feel free to email us. Let us know what your concern is. This is something that we just didn't willy-nilly throw out there. We bounced it off of our board of advisors. We talked to a lot of leaders that have been around for a long time, along with people that we know in the youth basketball community. And they all felt that this was very important that we get this off the ground. And so we thank all the people that have already joined, and we hope that all of you will continue to look into it and take advantage of it as an organization as well. So so Jeremy, why don't you answer this one? Our teams sometimes have more than 12 players due to not enough player for 2 teams. Will this be an issue if you're part of the alliance?
No, that will not be an issue. I know for mainly the player limit for rosters, basically that's in place for awards. So at our events that we can make sure we have enough awards for everybody, and people aren't getting a trophy or a medal when they show up. We can definitely work with you on that. Worst case scenario might come down to a situation where we just got to make sure for a specific event that there's maybe only 12 players that show up to that event. Trying to get playing time for any more than 12 players would be a logistical nightmare anyway, and put your coach in a really tough spot anyway. But yeah, we can work with you more on that.
All right. So just to summarize again, we are moving forward with the 3rd grade developmental league, and our hope with that is that we have a north-south location so we don't have to bother people with using their facilities. For example, on the north side of town, our hope is that we have the National Sports Center to use. So it'll be development or instruction along with gameplay for 3rd grade teams. We know that right now there may be some associations that, especially the early ones that are there in early November, that based on what the situation is with their district, that they may not be able to move forward in the same capacity of running their tournament, or they may not be able to. So we want to provide supplements for those teams to play games if they need to. And we will have multiple sessions available within quadrants of the Metro and Greater Minnesota where we can do a league-based and kind of go back in time 25, 30 years with league play, if that option is necessary. But we want to let everybody know that we are going to offer that. And it's going to be available for those associations, again, that can get a supplement to if they lose some tournaments with associations they have reciprocity with. More information will become available with that. I'm going to turn it over to the question about tryouts. And we're going over, so we have about 5-6 minutes. Tryouts during COVID, player evaluations, combine assessments, general association team development. So my colleague, Mr. Clarence Fields, is on, and he can just briefly touch on it. We have a webinar that we already have set up for next week for this, for you to take advantage of if you so choose. So Clarence, if you want to kind of highlight it and summarize it, go ahead.
Hi, everyone. Thanks again for being on tonight. I'm just going to introduce my team from Ballogy down in Austin, Texas. They're going to just speak for about 5 minutes. Todd, if you want to just go ahead and take over. He is the CEO the Ballogy app, and they have an amazing product and piece of technology down there. So Todd, take it away.
Thanks, Clarence. We're just going to take 20 minutes here 20 seconds, sorry. Just to kind of tell you what we're doing. We've built a professional grade mobile app for youth and amateur athletes to develop and elevate their game. We also have a coach platform where you guys can connect, engage, collaborate with your players like never before. And we're super excited to be on today and to meet you guys. Thank you, Coach Clarence, for championing this. And my partner, Zach Urbanis, is going to take you through a short Coach HQ demo.
Hey guys, thanks Todd. I'm just going to share my screen real quick. What I'm going to do is just play this 1-minute video kind of demonstrating Coach HQ. And then we look forward to getting in more depth and detail next Tuesday and kind of breaking down what we've created specific to you guys and your association. So give me 1 second and I'll share my screen.
In shot testing, players need to download the free Ballogy app and create a player profile. The app is available both on iPhone and on Android. Coaches then must sign up for a Ballogy Coach HQ free trial. Go to ballogy.com/CoachHQ to get started. For participating programs, coaches will get Ballogy Coach HQ for free for the duration of the partnership. You'll create a profile here by entering your information below. Coach HQ grants you access to the entire Ballogy database of over 180,000 players worldwide and counting. Once you're signed in, the coach can invite other coaches on staff to join Coach HQ under the same account, so there's not a need to create a bunch of new accounts. The next step is to create your roster. You'll click the Rosters tab, then go to Add Rosters, then Add Players to your roster. Remember, these are players that have already downloaded the app and have created a player profile first. This can be a group of players that you're working out in a small group setting, an entire AAU team, a virtual camp group, or any other collection of players you're looking to administer Ballogy shooting tests to. So to start recording shots, select the Test tab, choose the test type, and then select the drill. Once you've done that, you're off to the races and ready to record Ballogy certified shooting tests. Good luck.
Now with the Coach HQ, which is our coaches piece of the Ballogy platform, obviously there's a lot more that goes into it as far as player evaluations, but essentially we want to help associations engage, connect, and develop their players like they never have before. So we look forward to touching base with you guys next Tuesday and getting in more detail. And obviously thank you, Clarence and Dawson, for the introduction.
Yeah, Zach and Todd, thanks for being here, and I appreciate it. So if you guys have questions prior to the webinar, if you want to join and see what it's all about, you can for sure reach out to Clarence. There was a link in the reminder email that I sent out today of that webinar. There's 2 dates that you can choose from, the 8th or the 9th. So if you want to look into that, that's available, and it's a great partnership that we have with Ballogy too. So thank you again. All right, just some things to close. And I know that we probably didn't answer everybody's questions, and for that we apologize. But if you have things, because I know that this happened over the last few months, if there are things that was not addressed and you feel strongly that this should be something that we need to make sure to recap or get out to people, we will do that. So please feel free to email myself and Jeremy, and we will make sure that we get the answer out to the entire group. Things to think about. We have a lot of things within our resources and within the stuff that we've already created that your association can take advantage of. And it was at the bottom of that email, you know, with hosting opportunities, scheduling services, the Trusted Coaches platform if you're not using it, and other things that we have out there. I think more than anything, we just need to make sure as a youth basketball community in the state of Minnesota that we all continue to talk. We're all open, because we know that in one community or one association district, it may be a little bit different because of what is allowed compared to somewhere else. But I think having the open conversation is going to be very important. And I know that a lot of you, based on my conversations with you and my correspondence with you, you guys are very good at that. And for that, I think we are extremely thankful because of somebody like Bill Kemble, who has dedicated a lot of years in Chanhassen to making youth sports programming great, to people that are just coming into this within their leadership role. We are all here for all of you. And so we are going to continue to build this community and make it stronger together. Just keep in mind, again, next week, 8th and 9th, we have the webinar with Bology and the MYAS Rising Stars stuff. And September 10th, there's also something with the 10,000 shot challenge that is available for people too. I appreciate the support. Please don't feel bad if you're sending us an email saying, hey, what about this? You didn't cover this. We know that we had a lot on the plate today, and we said that we were only going to be here till 8:15, and it's 8:26. So, Jeremy, anything else that you want to express?
Just one thing I'll add here is about this year with how crazy and different everything is. You guys have probably seen it, that there's a lot of different groups or clubs offering some programming in the winter. I would just say, support each other, participate in each other's events. The last thing I think the winter basketball community wants to do is support events that allow all-star teams to participate in their leagues or their tournaments, or renegade teams, because the last thing we want is for you guys and gals to have to deal with that in your own community. So ideally, you're all able to sign up for each other's tournaments this winter. If we need to work on some alternatives, we can do that with you as well.
Yeah, that's a great point. We're all in this together. So let's continue to work together on it. You know, I think the one thing, just another note, the St. Paul and Minneapolis coalitions are still there. We are very proud that they are part of what we created over the last 9 years. But we also know that some of the concerns that Minneapolis and St. Paul youth basketball leaders had was that, why do you make us do this when you don't make anybody else do it? And we always talked about the fact that we wanted to make sure that we could vouch for all the organizations within Minneapolis and St. Paul, so they were eligible for whatever tournaments were out there, regardless of where they were. And now this kind of puts us all in the same realm, meaning that no matter where you are from, we are a Minnesota youth basketball community. And so I think that's another very important note. We're going to grandfather in all the organizations that have been doing it the right way within Minneapolis and St. Paul that are part of the coalition, and they will be a part of the MYBA just like everybody else. So the coalition name may be going away. That's something for both the St. Paul organizations and Minneapolis organizations to determine, and we're going to continue to work with them on that. But we, again, want to be one community together in the state of Minnesota. So with that being said, again, thank you for your participation and for the number of people that joined tonight. Again, it basically represented over 60 associations throughout the state, from War Road down to, I believe it was Owatonna, Albert Lee. So thank you so much, and do not be bashful in sending additional questions, comments, concerns. Have a great night, everybody.
Thank you.